Hello, I'm Felicity Cohen. I'm so excited to introduce you to my Wellness Warriors podcast. For over 20 years, I've been a passionate advocate for helping thousands of Australians find solutions to treating obesity and health-related complications through surgical intervention and holistic managed care. My podcast is dedicated to all the people, past, present and future, who have helped shape my journey and continue to inspire me to work consistently to achieve a healthier Australia in both adults and future generations. I hope you enjoy it. Welcome to the Wellness Warriors podcast. Today I have great pleasure in introducing you to Dr. Skye Marshall. Please make Skye welcome. Thank you so much for coming in today.
Of course, thanks for inviting me.
Pleasure. So lots to talk about. So I guess first of all, let's go back to when you actually decided to become involved in the world of being a dietitian. That was your first career pathway and first choice when you started studying. Where did that come from, and what did you actually anticipate at that point in time that you were going to be doing?
It was definitely a bit of a curveball. My whole family are artists, so I thought I would end up in that, career pathway as well. My pa and my sister are painters. My mum owned a craft shop and still does, and everyone just does artistic things and pursued artistic careers. And in high school, I was really drawn to photography, using the dark room and everything, which is a little bit sciencey because you have to use all the chemicals and be really careful about how you produce the film and that sort of thing. But I also really got hooked on nutrition because studying nutrition and food science in high school, it was almost like I didn't have to study. I didn't need to learn. I didn't have to try to understand. Whenever anything was explained, I just got it. And I think that's just because I was just so naturally interested in it. And so at the end of high school, I just wasn't sure what career path to go, nutrition or photography. And I applied to a photographic school, submitted a portfolio and got accepted. But then I took a 2-year gap to try and make that decision and become an adult and earn some money and that sort of thing. And in the end, I chose nutrition because I thought it might have a more regular and stable income, which is true, probably. So hopefully. Yeah, I had no idea what a dietitian was. I hadn't been exposed to that growing up in the country. I grew up on a macadamia farm. Everyone was farmers or artists around me. But I just thought it would be, why not try it? So I had to learn science and do a lot of catch up in the first few years, chemistry and all that sort of thing. But I just got so interested in it. And so I feel like I did make the right choice, and I always thought, you can do photography on the side, but I think if you want to do something, you need to be fully committed to it. If you want to do something well, having a split interest makes it hard. I think it just means ultimately those skills I got in high school mean that I take better photos of my dogs and my kid.
That's a good thing.
Yeah, that's true.
Yeah. Okay, so that was where the passion came from, and I agree, you've got to be driven by your passion, and it's really interesting to note, where that actually came from, and when something just clicks and you know that that's your pathway, you just go on it. And for me, I'm celebrating now 20 years having been in this business, and I find it really hard to believe sometimes. I have to pinch myself because that time has just gone so quickly. And I think obviously when you love something and you feel passionate about your contribution to what you're doing and how that develops over time, that's definitely the way you choose your path.
Exactly, yeah.
So post dietetics study, then what? Where did you go from there?
Yeah, so to study I needed to move to Newcastle or any major city, so I ended up in Newcastle, but I was really keen to move back home. And in fact the New South Wales government was offering scholarships if you undertook your study to become a health professional and then move back to your rural area, because they're desperate for allied health and health workers in rural New South Wales. So I was awarded a scholarship, which was great. So I was also really lucky enough to have done my clinical placements during my study back at home in Lismore. So I knew everyone there. I was just basically walked straight into a private practice in a medical centre. And, you know, when you're rural, you're kind of everything. So I was the private practice dietitian in the medical centre. I was the hospital dietitian. I was the dietitian driving around to see veterans out on their farms all around the place. And also then the community health dietitian. So I had really, really broad experience across all of dietetics, which was fantastic. But you really do miss the team environment, I think, working closely with other people and learning from them. So that was quite hard not to have that as a new graduate.
Absolutely. So from Lismore then where?
After doing that and working in private practice for a few years, I guess I got a little bit bored because the patients that you tended to see had a lot of repetition in them, and I'm someone who needs sort of a long-term goal to work towards. And I think that I just am the sort of personality that doesn't work really well with just seeing client after client, because my main concern was like, okay, well, I'm seeing a new patient walk in the door every hour, and some of them will come back and I'll see them again. But especially in the hospital setting, once they go home, I have no idea what happens to them. And looking at our guidelines in nutrition and dietetics, in fact, there was almost no research to show if a patient comes into hospital and you treat them for malnutrition because they're not eating very well, once they go home, what happens? Yeah. Everyone there is saying, oh, I'm fine. I just want to get home and I'll be okay once I get home. But are they okay? And is the advice that I gave them helpful? I don't know. So I was lucky enough to do a bit of research in my degree choosing honours. And then I just started talking to some colleagues thinking, I think I want to do some research around this so that we know if the advice we're giving is actually making a difference in the long term once patients do go home from hospital. So I just contacted Professor Liz Eisenring. She was at the University of Queensland at the time. She had quite a good reputation for doing research in the sort of hospital space. So I contacted her and said, I might want to do some research, and I sent her my CV. So she called me and basically convinced me to do a PhD, which seemed so big and like, you know, full on, and I never thought I could do anything like that. But under the right guidance and mentorship, I guess 4 years later, I had a PhD.
Fantastic. And then obviously that's exposed you into a much bigger, broader world, and a space where now you're actively involved in so many different projects that are research related. So your career pathway's taken quite a significant turn. And so at the moment you're involved in multiple streams of research as a supervisor, conducting research and all over the place. So tell us a little bit about what that looks like for you now.
Yeah, I guess that's true. Some people choose a really narrow field to do in research, and then they'll stay on that and develop a really strong track record over 10 or 20 years in that one specific topic. But I find that I just get really excited about learning something new. I mean, so often we'll have conversations with colleagues and we'll talk about, I wonder why that happened, or I wonder why this patient went so well and this patient didn't, or I wonder what we could do to make this treatment a bit better. And I just thought, maybe we could do a research topic. So bariatrics was something I had no experience in. We don't really do that in rural Australia. People usually come to metropolitan areas to receive that service. So when the topic came up, when you contacted Bond University for a study in bariatrics, it was something that I was just like, okay, I know nothing about that. Maybe I probably should know something about that. And then doing a lot of reading into that, I just realized it's another space where a lot of what is done is based on the health professional's judgment. And there's so much scope for research, so we've got a better idea about when a patient comes in to have bariatric surgery, what might their outcomes look like, and what are the risks associated with it, and what are the diverse benefits that they get from that as well.
So let's just dive into what you do, what your role is here, and how you connected here at Weight Loss Solutions Australia. So I just want to talk a little bit about the ENvISage study, which is our study exploring the endoscopic sleeve gastroplasty, and I see that as being quite groundbreaking, because unfortunately in Australia at the moment the landscape is actually preventing a lot of clinics on focusing on endoscopic sleeve gastroplasty procedures for multiple reasons, and so there's a lot of political agenda that's kind of obviously infiltrating choice around procedures. My greatest belief is that this is a procedure that is growing exponentially worldwide. The growth in the endoscopic space is huge, and what we can offer patients with an endoscopic procedure I think is really important to explore. If you can offer a patient a procedure that is non-surgical and it's the right procedure for the right patient, and it's going to give them good long-term potential outcomes from a weight loss perspective and a health outcome perspective, then we should actually be looking at doing this more and more frequently and growing that space. So that's the first thing that comes to my mind when looking at endoscopic procedures overall. It's quite an exciting space. Obviously, no cutting and no dissection of the anatomy, shorter hospital stays. All these things come into play when we're looking at an endoscopic type procedure, and then obviously patient outcomes are really critical when we're considering this. But sadly, in Australia, it hasn't been widely taken up. The procedure at the moment doesn't have a Medicare scheduled item number, which means that it's expensive and difficult for patients to access. So for me, as an advocate for the patient, and always wanting to look for best potential solutions to support any patient for weight loss, whether they're overweight or morbidly obese, I think for me it's absolutely critical, and it's part of the moral fibre of where I come from, sitting in this seat 20 years post working in bariatrics, that we need to look to the future. So I get really excited when we're looking at a new procedure that has so much merit, and internationally you can see when we've been overseas and seen in Spain how much more this is taking off in other parts of the world. So my hope is that this will be enough to be groundbreaking and to break down some of those barriers around acceptance of endoscopic procedures, and specifically the endoscopic sleeve gastroplasty, and that it becomes a more popular procedure eventually over time. So that's a big picture. Where I'm coming from when we're looking at endoscopic sleeves, and it's changed obviously over the last couple of years, but it's a really exciting project and fabulous to watch. Patient demand is growing all the time as well.
For the ESG.
For the ESG, it's becoming more and more sought after, and you can understand why from a patient position. Why wouldn't you want to go for that if it's right for you? And the world of bariatrics, obviously over 20 years from a medical technology perspective, has vastly changed, grown and developed. So I've actually witnessed that right from the outset when we only had gastric bands to offer patients, the laparoscopic adjustable gastric band. That was all we could offer patients 20 years ago. So the growth, change and the overall evolution in this space has been massive. So I'd love to hear what your thoughts are on the ESG and the study and how that looks for you.
Okay, so the ENvISage study was lucky enough to be funded by the Commonwealth of Australia, a grant called the Innovation Connections Grant, which is to support research that involves industry, like WLSA, the medical practice as an industry partner. So we've received 2 years of funding, and in the first year, we asked any patient who is having the sleeve, the laparoscopic sleeve, or the ESG, and they lived kind of locally to the Gold Coast area, if they wanted to participate in the study, which would involve filling out 2 surveys every 6 months, and also getting a DEXA scan. So what we did is we looked at not only what you know, their weight was, but also their body composition using the DEXA scan, which means we can look at how much bone they have, how much muscle they have, and how much fat they have in each of the different body compartments. But we also looked at other outcomes, including their medical status, things like cholesterol, blood pressure, risk of diabetes, that sort of thing, and their quality of life, specifically related to being in a bigger body. In addition, we also looked at like gastrointestinal symptoms, like, you know, were they getting reflux, bloating, and having just a bit of uncomfortableness through that whole digestive system. So we looked at those outcomes before they had each procedure at 6 months and then again at 12 months. Yeah. So right now we're almost finished collecting all the 6-month data, and we've started collecting some of the 12 months. But the thing that I really like about the ENvISage study is that it's not so focused on weight loss as on health. So I know, like, weight loss is one of the most Googled terms. It's in the name here, and probably a lot of the patients and even some health professionals and society in general is so weight focused. But really what we want to do is improve people's health, not just their weight. So the weight can be related to improving health, but just because someone has you know, a greater weight loss with one procedure versus another doesn't mean that the benefit they have on their health is necessarily greater. So what we're doing is we're having a look at, yes, what is the change in weight over that 6 and 12 months, but how does the body composition change? So sometimes what I have noticed is that patients think that they've put on weight when they come to do the DEXA scans, or that their weight hasn't changed at all. And what we've found is that they've improved their muscle mass, but their fat mass has continued to decrease, specifically in the high risk areas, which is around the neck and around this abdominal area there, which can increase risk of sleep apnea or chronic disease. Yeah. But also we're looking at, you know, how has quality of life improved? And if quality of life has improved a lot, then it doesn't necessarily matter whether it was 18 kilos or 22 kilos that was lost. What you want to do is have a better quality of life and be able to enjoy life and participate more in it. So I think that's what's really good about the ENvISage study, and it's looking at those 2 procedures. And I mean, my hypothesis is that they're going to be quite the same and related to those outcomes around health and quality of life. But I don't know yet, and humans are quite flawed at judgment. I think we can have we can think that we're seeing something, but we need those numbers to back it up. So it'll be really interesting to get those numbers in a few more months.
I mean, definitely your interpretation around the study and the benefits from a health perspective reflect my philosophy in relation to why we do what we do here, because it is absolutely 100% first and foremost, it's health outcomes. So reducing medical comorbidities that are associated with weight. We're not focused on how much weight a patient's going to lose at 12 months. What we're looking at is where is that patient going to be 5, 10 and 30 years out. Yeah. And for me, that's so many different things. It's reducing their risk of multiple medical comorbidities for the future. It's dealing with whatever they have right here and now, any medications that they're on, and then of course all of the quality of life issues, the mental health issues that are associated. So for us, it's a lot more about that bigger health and wellness kind of story, and the multidisciplinary team in this space is so critical to driving those long-term outcomes. So the end result for us is about what do we want our patients to be achieving, where do we want them to be in 30 years? Well, we don't want them to be in nursing homes. We want to avoid the endocrinologist, the cardiologist and every other specialist that we possibly can, and definitely quality of life outcomes for us are key. It's number one, and that's the story that we're seeing come through. So in this podcast series, we're talking to patients who had surgery, for example, one who had surgery in 2002, and we talked about the story and where she's at now 18 years later. So the longevity of outcomes as well is really so important. Best procedure obviously for each individual is really important, but the bigger picture is health and wellness, and the podcast that we're talking on today is all about wellness, which is what we're mostly concerned about. So one of the other studies I wanted to chat to you about briefly is Project GRIT. So Project GRIT is our childhood obesity prevention study, and GRIT stands for Growth, Resilience, Insights and Thrive. That it has lots of different potential opportunities to explore how we can improve the health in our younger youth and adolescent population, and how we can, hopefully assist and help prevent in that group of patients potential weight risk issues for them down the track as they become adults. So tell me a little bit about what you think about Project GRIT and where we're up to now.
Yeah, sure. So Project GRIT is a project that WLSA hosted in 2018, where we were able to recruit kids and adolescents from 9 to 15, and over 12 weeks provide them with some exercise training, so doing some running in the park in small groups, some sessions with the dietitian in small groups as well, where they just learned about, getting familiar with all different types of healthy foods, some cooking skills and that sort of thing, and then some sessions with the psychologist, which involved some mindfulness and also some mood regulation techniques, something called EFT tapping. So what we did is we collected outcomes on the kids at, before they participated and at the end. And in the pilot study, we found that the children and adolescents were able to improve their body image and their self-concept. They also decreased their dietary intake of discretionary foods. So the kids that were involved in the project, as you say, as a prevention study, they didn't need to be, any particular weight or BMI or anything like that. It was aimed at kids who are sedentary. And I think the good thing about that is it's kids who might not have the confidence or skills to go out and do exercise, or know what food choices to make, or maybe the impact that their food choices have. Also, a lot of the opportunities that kids have to exercise is either in school, where there can be difficulties around confidence in that environment, especially with some bullying in some schools, or I guess different dynamics between students and staff as well, that they may not feel like they can try something new in that environment. So I think it was good to have GRIT out of the school environment with new kids, to make new friendships and to learn new skills and build that confidence. So I think that a program like that can be really beneficial for children and adolescents in Australia, where screen time is just increasing. And what we're trying to do with that is, we've got this small pilot study, and now we want to roll it out. We want to make it bigger. We want to see if it can be sustainable, if it's something that the government can support to run alongside each school term, and keep the kids interested, and when they are online, to help it to be a really healthy environment, to help them to engage and build and contribute to their social connectedness instead of being isolated.
Yeah, absolutely. Well, I'm super excited for the future of Project GRIT and ENvISage, and where we head with endoscopic type procedures. I'm also really excited about research as a whole for me, in terms of what we can achieve. Obviously, there's a lot of potential opportunity with data that we collect here every day, and we're seeing lots of different diverse patient populations and all having different procedures and coming from different areas. So yeah, I think that hopefully long term we're going to grow our research presence and develop our team here and see some exciting things evolve over the next 5 to 10 years. So if I can think about, well, what does that look like, and what does that vision for me look like in this particular space, and where are we heading, hopefully we're going to be groundbreaking, not just in Australia, but achieving some really fabulous things in research. And it's exciting having you head up the team here and work with us, so I absolutely love it. The opportunities are endless. Yeah,
I think that a research studies like these that are partnered between research organisations like the university and then an industry partner like WLSA, they produce research that is really going to make a difference, because universities and researchers sometimes can get a little bit isolated, and they might be producing good research and publishing in really good journals, But how do you then translate that? You know, how do you get the message out? And that's, we've got in research a huge drop off there. We publish something, we go, oh, this, you know, this treatment's going to be really effective, and then no one takes it up. And that's because they haven't engaged with stakeholders. But where research projects come from industry, where industry says, this is what we need research on, if we can research that, it means it's going to make a difference straight away. As soon as we get the result, it's going to be implemented into practice. So it will truly make a difference for patients and for the individual.
Yeah, super exciting, and can't wait to see the future of that evolve. I do have a question for you before we finish our chat today. So for you, what does wellness look like and in your day-to-day life, in your family, and how you live out for you wellness in life? What does that look like?
Yeah, good question. I think for me, it's being connected to your body, feeling that you really inhabit your body and that you're part of it, that it's not something separate. And I definitely fluctuate on that. Sometimes I feel like it's completely out of control, and then other times I feel like I'm more at one with it. I feel like it's being connected to your family around you, making sure that the time you do spend with them is really quality time. You know, both myself and my partner work full time, and we have a 5-year-old, but we don't get a lot of time with her, but when we do, you've got to really make it count. And I also think it's being really connected to nature. So having a space around you that isn't a built human environment, having a lot of connection, and just, I think, getting the visual feedback and all your sensory feedback from being in the natural environment can make such a difference to your wellness and your mental health, and being able to regulate your emotions and calm down at the end of the day without needing a glass of wine.
Love that, and I love that whole concept of having your nature pill, or 20 minutes in nature every day. It's something that I strive to fit in every morning, you know, whether it's going for a walk through the headlands at Burleigh Heads, or running, or whatever it is, that I try and make it in nature every day. And I think for a lot of people that might be just sitting in nature, having that 20 minutes of time out and being a bit connected in that way. I think that's really valuable. So important, and I love that. Thank you so much. And thank you very much for coming in on the Wellness Warrior podcast.
Awesome, thanks for having me.
My pleasure. Thank you for joining the Wellness Warriors podcast. It's been a pleasure to have you online with us. If you've enjoyed the series, please leave your review, subscribe and follow, and we look forward to sharing many more stories with you in the future.